The other side of the coin is economic evaluations. We've got a PhD going on at the moment, somebody doing a PhD with us. Looking at what's the evidence for the economic benefits of accreditation. We spend all this money. Does it yield benefits? Economic benefits? Is there a cost-benefit analysis of accreditation? And the answer is many people have had a look at this, and it's very difficult to work out even what the costs are. Because if people are doing quality and safety and improvement, presumably they should be doing this anyway, regardless of whether there's an accreditation process or standards. So it's hard to work out what is the cost of actually accreditation. I mean, we can easily know what ECAS costs. What's the wages bill? What does it cost to run ECAS each year? But what does it cost organizations to implement standards under an accreditation regime that ECAS stimulates? And is there an additional cost that people have to bear? So we're looking at that, and we've got a health economics student looking at that at the moment. But it's very difficult, this. It's a very difficult area. It's hard to quantify the costs. It's very hard to quantify the benefits that accreditation produces. Nevertheless, we're trying to do that. Another study that we're interested in, or a stream of studies, is public disclosure of accreditation. So to what extent should we have, not only public disclosure of people's accreditation results, but maybe league tables, like, soccer league tables of where people stand in relation to their accreditation results. Would that stimulate further improvement? For example, the ones at the bottom might be stimulated to improve by naming and shaming them. Having public disclosure of your accreditation results. I can't remember what happens here now.
We are very transparent. Awards are public, but the reports with the findings are public, and probably in the third version we will go one level deeper and also publish what we call the findings reports.
But would you think of having all the hospitals in a table, and the ones at the bottom would be?
No, we wouldn't.
But anyone could do that, just to say.
Yes.
What's sort of like a newspaper journalist?
That's right.
Yeah.
You just take out the information and rank it.
Yeah. I better not give them any.
But I think
tips.
already the hospital does.
The hospital, of course, does.
They do it already because
Internally within the hospital.
Yes, they do.
So they might, each hospital or some hospitals might know if they're there or there.
Yeah.
Interesting.
But our message would be careful.
Yeah.
You may think that this demonstrates that you are here and you are there, but the world is not that simple.
No, and you might change.
Yeah.
So there's no point in being there and saying, I'm the best in the world, or best in Denmark. And then 3 years later or 6 years later, you're much lower. Interesting. Anyway, we're sort of looking at that. We're looking at what the implications might be of the public disclosure of ranking accreditation results. We're kind of scary, aren't we, some of the research we're doing? The other research that we do, and I'm going to finish shortly, points to a couple of other things. Collaboration is very important. So you're not really just an accreditation agency, you're not just ECAS. You're really in the middle of a network of stakeholders. It's very important to work with those stakeholders because they have different views to you. For example, those interviews that you've done, I applaud that because you are trying to understand your stakeholders' perspectives, which are different from yours. And then that builds the best or a better next generation of accreditation. And also too, and this is kind of one of my last slides, is we have done a lot of work to have a research accreditation agency partnership. And we think that's been very beneficial too. We think it's been very beneficial for ACHS, Australian Council on Healthcare Standards, and AGPAL, the general practice accreditation provider in Australia, and the aged care standards accreditation provider. That's aged care, acute care, and general practice. We've worked with them now for 10 years, running all of these research projects that I'm discussing alongside their development. So while they try to develop hospitals like this, and they themselves try to improve their accreditation programs, so the agencies, the accreditation agencies like UCAS, are on a curve of improvement too. We've tried to come working with them in partnership to try and underpin their developments with research. And we think that's been a very effective model, as Carsten said at the beginning. We think that's helped them to be more reflexive, more thoughtful about the way they've developed accreditation. And certainly it's helped us because it's enabled us to get research grants and really investigate quite deeply how accreditation works. And we think that's been a very good partnership, and so do the accreditation agencies. The only final thing is, as you can see, we've done a lot of studies and written a lot of papers. They are available. If you can't get them for some reason, if they're locked up in some obscure journal, just email me and we're happy to track down that paper and send it to you, if it's of value to you. It's like having your own research arm in Sydney, Australia, isn't it? Send off an email and we'll send back one overnight while you're sleeping with a paper that you can't find. We're very happy to do that because we've got an entire group devoted to this with David Greenfield and some other names that you would know who are working on this accreditation journey with us. And also we've done a lot of studies and we've published a lot of our research protocols. So before we do research, when we design the study, we publish the protocol before we publish the study eventually. And so those are free. They're available. And if you're designing a study or you have some PhD students who are designing a study, you can have a look at our research designs. They're publicly available. We've published most of them, and they can have a look at that so that maybe we're working in concert, even though we're 11,000 miles apart. We can be working in concert, maybe doing research and trying to underpin improvement of accreditation through our collaborative efforts. And if all of that fails and you get to go to ISQA, I'm always at ISQA. Not because it's really nice exotic locations, because that's where I work very hard discussing the results of our research. Thank you for listening.